please feel free to do that if you have public comments. Also,
At the county meeting, people can come in and fill out a card and indicate that they have something they'd like to say, and that doesn't have to be on the agenda or anything, and they're able to, since they drove off and they want to share something.
for that
So the
information.
24-hour notice, I don't think would be appropriate. Except, if somebody wants to comment, we should be able to.
Okay. Also, the meetings are open to the public to attend. So I see we have at least one visitor today. How are you, ma'am?
Thank you. Great. Glad to be here.
What's your name, please?
Alicia Embry. I live in the unincorporated part of Imperial. Appreciate you doing them and now allowing us to attend again. Thank you.
Okay, great. How do you spell your last name? I'm sorry.
EMBREE.
Okay, great. Thank you. Welcome to the meeting. Okay, so having said that, I'm going to call the meeting to order. Can we have a roll call, please?
Dennis Steele,
Here.
James Prater.
Here.
Tim Pig,
Here.
Dr. Henry.
Here.
Susie Davis.
I'm here.
Okay, so all board members are present, so we have a quorum. We usually start the meeting by reading the health department mission and vision. Do you mind doing that, Dr. Henry?
JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County.
Thanks. So everybody should have received the proposed agenda. I have a motion and a second to approve that, please. Motion to approve.
Second,
Okay, any discussion?
I was just wanting clarification on the new businesses after closed session. Was that intended to be that way or?
Yes, so we can discuss any questions you might have about the legalities of the operations manual and the other items that are on you. Directions.
So just so anyone watching knows, we will have a closed session, but we will then come back into open session before we adjourn. So, all in favor of approving the agenda as written, please say aye.
Hi.
Okay. Zero. So we have approval of minutes and expenditures. Minutes that are pending aren't available today because our secretary is out. So first item is approval of the July 2022 expenditures. The amount I have for those is $216,247.88. Motion to approve.
Second,
And instead of motion and second to approve those expenditures.
Mr. Chairman,
Yes.
I'd like to open it for discussion about these expenses in particular. Recognize me, so I'm gonna go ahead. So one of our vendors, if you guys are looking at that page, on 77 is Architect Now. And I just have to open up my packet and I was looking through there and I was like, 31,000, okay. And then I went on down the page a little bit further. And then I said, well, what was that for? And it says Aspen Development for School Enhancement. So then I went down the page a little bit further. And this is part of the board, we're here to oversee things. And so, this is for my fellow board members to think about. And then it's on the 27th of July, Architect Now, the vendor, was paid $38,000 for quote Aspen Development again. And then again on the 27th, the same day, this Architect Now was paid another $38,530 for the development of Aspen school portal updates. And I added that up, I'm like, holy cow, that's $108,000. And so it seemed like a lot of money to me, and, you know, I know my fellow board members would agree with that. So I was like, well, what the heck is going on here? So I just kind of looked back in a few of my other, what I did have handy. I didn't have time to do a lot of research, but I went back as far as 2021 and noticed that same vendor was getting about $326 a month, or $421 a month. And then the month of June, which was last month's expenditures, Architect Now, Aspen Portals Development got $27,000 more. So holy cow, now we're looking at 1, 2, 1, 3, 5, so $135,000.
Thanks.
Yeah, and I absolutely, we're gonna ask that.
Actually, those have been discussed in prior meetings, but Kelly.
What kind of school portal are we doing and why?
Well, Ms. Davis, I'm very glad you asked. One, glad that you can add those because we do have a comptroller that does that for us. Second, Aspen has been reviewed several times in the previous several months, including presentations here to you in person. Aspen is funded by a SAMHSA grant for all of its development. That is the mental health assessment that is being created for children and their families with the resources, which you specifically stated you thought was a fantastic idea. And so those funds,
Condescend when you talk to me.
Ms. Davis, I'm
Just
speaking
answer
in
this that
plain
particular
language
vendor
here.
does to us, that would be fine.
That's fine. You asked for 108,000 when it went to development of a mental health tool to meet the needs of the Jefferson County youth. And that is developing a school program. It is developing a program for first responders and for healthcare individuals. So as far as the invoices that come in, we get invoiced as sections of that program are completed. And these are the invoices that are received, reviewed, and were approved by the board for the vendor prior to going into the contract.
So does anybody else have some questions? Because I've got a lot of them here. It's just like
Because we've
$100,000.
already gone through this, we've already approved it, we knew what it was, they did a presentation.
We- We
Yes,
don't
you did.
know
This is
exactly.
grant money
Great,
that you spend on these things, yeah.
So you're saying that you got a grant for these
Have you been here
things
the
that
last
we're
4 or 5 meetings?
Tim, please, we
No,
just
no,
save
please.
that, save
I'm
that.
asking you. Have
I
you been here the
want some
past 4 or 5 meetings?
clarification, you know, there are
Have
people
you
watching on
been here?
YouTube.
I'm asking you a question. Have you been here the past 4 or
Instead
5
of,
meetings?
and instead of cutting me
Have
down,
you? No, I'm not
let's
cutting you
just
down. I'm
finish
asking you.
answering the question.
Because it's been here.
We just explained.
Okay, so you're saying there's some grant funds, okay, but still $108,000, and all of a sudden it jumps up to 27,000 from 400 a month. And then, 31,000, 38,000, 38,000. Exactly what is a software program doing for that amount of money? What, show me the software program.
Ms. Davis, we actually did pardon me,
Let's
I
see what it
apologize.
does.
We actually did a presentation of that software in the board meeting for you.
Good, show me the paperwork.
We
That's
showed
what
you
I'm
the
asking.
paperwork and we have showed you the demonstration of the program. We have brought the personnel from that program
You don't
in
need to raise your
specifically.
voice, Howard.
This is frustrating that you are an elected member of our community who is here and is
You do not
responsible to the
need-
staff of this
Not need to
agency.
condescend to me. That's not.
Ms. Davis, will you take your job seriously and I will stop being condescending?
I am taking my job seriously, $108,000 spent within, actually $135,000 spent within 2 months' time on software. So what does it do? Let's tell the public, okay, so maybe I have the paperwork, okay?
The public was in on the presentation.
For everybody's realization's been discussed.
What
It's
exactly?
been given out. She was here for the presentation, and this is Groundhog Day for about the 5th month in a row.
Let's move on.
No, but the discussion's over. All I want
We're
the
not
public.
gonna wait.
Every motion, call the motion.
What is $135,000 in 2 months
Call the motion.
being used for?
Stay after the
Exactly.
meeting, we'll explain.
Call.
We're not
No.
gonna-
The people are listening now.
They heard
I
it
don't
when
wanna
we
know.
did it before.
Do you have anything else?
No.
I just want them to understand what, so you say it's for schools and mental health, exactly what? Are you tracking kids? Are you? keeping- what's it gonna be?
Tracking kids for,
So Ms. Davis, Brianna, will
Anybody-
give a short explanation for Ms.
Yeah.
Davis.
Very quick, I know, I'm sorry, I'm just gonna summarize it very quickly so we can move on. Aspen is the program that we've been building for a couple of years. Jacqueline Brown has been doing that. We're working with all of the school districts to be able to provide a database and resource directory where students can, and staff can access all the resources for mental, physical, emotional, social health, agencies within the community. So it's a big project. IT here can probably say, nobody in our department, in our agency build stuff like that. So we went out to find, we used grant funding. So it's all grant funded, that money that you're talking about, is all grant funded. And also, if you want to see a little bit like more of a recap of what the program is or the things that we did, it's on our website. If you go to, I can email you the link later. Specifically, we did a whole Facebook Jeffco Health Matters video on it. And Jackie kind of walked us through the program as well. So you can actually see that portfolio and get a rundown again.
I appreciate that. Thank
Yes.
you very much.
You're welcome.
And it is grant funded.
Correct.
So, only thing I'd like to see is where the grants came in for that amount. and,
Sam,
you know, then I can be.
You've
a lot
seen it.
more comfortable with it.
anything else?
That's it.
Okay, so.
Oh, yeah, one more thing. Just while we've got the discussion open on whether we're gonna okay all these things. Again, we have $9,000 this month for legal fees. This time last year, we were spending $1,000.
There's no comparison between this year.
Yes, there is. We still have the same department. We still have the same attorney.
We have
we
to-
still
we
have-
happen to have a epidemic.
We do not have an epidemic. We are in endemic.
Well, I'm
we're done
glad
with
to hear
that.
that you denied that COVID was never an epidemic.
We're not gonna go there, Mr. Deal. I'm just saying, there's no difference now between then
You're-
and now.
you're
We
totally
have the same
wrong.
attorneys. We have the same
Let's
business
move
going
on.
on. And it just seems like she's making sure she gets about 9,000. You know, it's still not okay. It's still not okay. And by the way, she's driving a brand new Humvee out in the parking lot, so.
That is really.
Well,
That is
it's-
interesting. Miss Davis, I was just as somebody who's not the person you just attacked. That is not an accurate presentation of facts, which is pretty hard for course for you.
Whatever.
All right, so.
It's, what's accurate is that we were
Everyone
spending 1,000 last year, now we're spending 9,000
Aye.
average. Which is different.
2022, please say aye. Aye. Any opposed?
Myself,
All right, that's for the one that's approved. Next is approval of the July 2022 electronic payments. The amount I have for those is $482,135.15. Motion approved. Second, okay, a motion second to approve those, any discussion? Hearing none, all in favor of approving those electronic payments, please say aye.
I,
Those are approved, and we need finally the pre-approval for September electronic payments. The estimated amount for those is $604,687.25. Motion to approve. Second. There's no motion, second, we approve those. Any discussion on those?
are those for, automatic payments, electronic payments, Mr. Deal?
We include those because if we don't pre-approve some of those payments, Ms. Davis, they're late. And we wind up paying a penalty, so practices to pre-approve those electronic payments, and it's an estimated amount. Okay, so all in favor, please say aye.
Aye.
I,
Okay, those are approved. All right, move on to the director's report. First item is clinical services report by Melissa Parley.
Hi, good afternoon. So just a couple highlights on the clinical services report. You'll see that the majority of this report is focused on our electronic medical record system change that happened August 1st. So we implemented Cure MD as our electronic medical record system. And this project was also grant funded through the adult immunization grant. So when you see those charges come through, you'll note that that was also through some grant funds. Couple of things that it does for us. I just want to make sure you guys are aware. Our previous electronic health record system was quite dated, was server-based, and was quite cumbersome to work through. So this new system is a web-based system, creates a lot more portability, especially for our mobile clinics, our clinics that are out in the community, creates a lot more flexibility for our agency in the way that we operate our clinical services. It also provides a patient portal. So patients can have access to their medical record, their test results directly from that patient portal. So it's a much more streamlined process for patients to be able to access their own records. It also allows us to do electronic reminder. So for patient appointments, forms, things like that can be sent out electronically, where before we were making calls and using manpower to do those reminders. It creates the opportunity to do a mass vaccination clinic through this software system. It also gave us the opportunity to add an inventory module. Previously, our inventory was all managed manually. So this module creates the ability to move things to an electronic platform and to manage our inventories electronically, to dispense electronically. So it really does move us in a different direction.
Does that track like expiration dates?
Absolutely, expiration dates, the NDC codes. When we dispense it, we get a label that's printed out that provides all of that information. Allows us to do consent forms electronically. It also will allow us to have electronic transfer of vaccine records directly to Show Me Vax. So we struggled with that in the past in our previous system, and we were doing a lot of that as manual entry. Also, we send electronic data to MFHC for our Title 10 data, and that was being done manually. So this system will also allow us to move that to an electronic platform. It also allows our medical director to view charts and results without being on site. So that he can log on to the web-based system, enter his log on information, identify the charts that were assigned to him, and view them off-site. It creates an electronic checkout process. Our checkout process before was all manual. So now, as the procedures are being done, they're entered into the system. The checkout process is directly related to what has been done within the clinic areas. We had the opportunity to train multiple super users. So we have folks on site who can correct things, fix things, be a resource as we go forward. That was one of our concerns with the previous system, is that we had to contact the vendor if we needed changes, as we added things, as our clinical programs grew and changed. We really struggled with needing that vendor input on each of those processes. It also increases billing consistency and reporting. So we really struggled with our previous reporting options, and now we have a lot more options for reporting. I wanted to let you know what a wonderful job our staff did on this transition. It was huge. I don't know if any of you have been through electronic medical record system change, but it is a huge process, and our staff have been very flexible. If you have been through this, you know that it's not right day one. We have to continually work at it and fix things as we go, and they have been very good at working through all of the things that have come up. Any questions about that?
Is dental using their own system or? Will
They are. So the dental clinical processes are so different than medical, right? So dental uses Curve, and we changed their electronic medical record system last August. So they've been up on Curve for a year.
So does this have a name?
Cure MD.
So we'll see it, you know, on here as what exactly? Say it again.
It should be Cure MD.
CUREMD. Okay.
It's on our board packet.
Okay, anything else?
That's good, thank you.
Thank you.
You have another report?
I'm next.
She's
Like, stay right here.
But wait, there's more.
Yeah. So I wanted to give you guys the opportunity to see a presentation that our mobile wellness team is getting ready to do at the annual Mobile Healthcare Conference in Phoenix this weekend. So we were invited to participate in this conference and to present in a breakout session at the conference. It's a national conference, so there will be mobile healthcare folks from all over the country. So we have the opportunity to kind of walk through how our mobile functions were pre-COVID, during COVID, and where we are now. So this is an hour-long presentation. I'm not going to go through the whole thing for you guys. I have a
Trying to figure out if I can make this work for you, so you can do it your own speed.
let's see.
Sorry, I was trying to be
Oh,
innovative.
I'm going the wrong way. Okay, here we go. Okay, so just putting our mobile services into 3 buckets, right? Mobile dental, our community clinics, mobile healthcare, okay? And you guys know where we are and what we do. So I won't go through that, but mobile healthcare, our mobile wellness van does, and they've done presentations, so this isn't new, but they do sports physicals, daycare physicals, screenings. They see patients for acute chronic care, nutrition counseling, provider referrals, community resource information. Mobile dental, so we have both pediatric services and adult services that we provide. We do things like preventative care and restorative care. And then we have our community clinics. So we have a long history of community clinics. Whenever I went back to look to see where I could find the date of when we started it, I couldn't find a date. So we've been doing this for a really long time. Things like school-based vaccine clinics, event-based lead screening clinics, school-based back-to-school immunizations, homebound flu, homebound COVID, and event-based health screenings. So there's a lot of clinical services that we have and continue to provide directly into the community. Okay, so then this just walks through the timeline of what happened to mobile services and where we at now. So we did stop mobile services for a period of time and move staff in a different direction to help with COVID. But we also partnered. So during that time, we were partnering with a lot of folks in our community, which is still part of our mobile model. So this is a picture of when we partnered with Mercy to provide COVID testing. So even though we may have not had the van directly doing some of the things we were doing before, we were still providing services. We were still partnering to meet the needs of the community. And then we added services. So we added COVID testing and we had added COVID vaccines. And then, of course, we had to make sure that if we were going to go back out in a mobile setting, we have to make it safe, right? So PPE, cleaning products, making sure we have the filtration system, patient screenings, UV light, all of that stuff was looked at. And then this goes through the different types of partners we had. So we worked with county government, faith-based community, business and local organizations, school systems, hospital system, regional partnerships, mental health providers, FQHCs, and of course, MDHSS. So then we returned to mobile services in 2021, both in dental and our mobile healthcare services. And then at that point, we looked at how can we continue to support this? What can we continue to do? Because we know access to care is really important in our community. We know that not every patient can get to us, so we have to go out and provide services and meet them where they need. So we looked at and found grants like the Direct Client Services Grant, Access to Care Grant, Health Disparities Grant. We work with partners like the Rotary Clubs. And then we also utilize CARES Act funding. We added the 3 mobile vans for daily community events. We updated our dental electronic medical record system, and we just updated our health record system. We also had to create the staffing infrastructure, right? So we had to make sure that we had staff who were able to go out into the community to provide the services needed. So we had to look at how we adjust our staffing, move people, create that flexibility. And we did. We adjusted our community mobile services so that we're now seeing adult Medicaid patients. For dental, we are performing teledentistry services. And we are also adding new clients for mobile wellness. So in the past year, we've added our local community college. We've added school systems. We've also added additional residential care facilities. We also expanded our testing model. So on our mobile wellness center, we expanded what we're able to do as a point of care test so that folks coming on can get some answers right then. We also partnered with Aging Ahead to be able to provide mobile vaccines and homebound vaccines. So this walks through teledentistry. I know Dr. Grant did a presentation on that. And then this is where we're at today. So mobile wellness, we have our RV unit. We're providing primary, chronic care services, physicals, labs, 6 visits, well visits. Dental, we have our 2 units. One focuses on pediatric, one focuses on adults. And then we have our community clinics. We do a wide range of those. We're still doing a wide range of those. These are the numbers from 2021. 1,406 flu vaccines provided. 201 pediatric dental patients. 23,895 COVID vaccines. 505 mobile wellness patients served, and 462 adult dental.
So then the 23,895 figure is just what was done at the mobile vans, or?
No, that was since most of our COVID vaccines were actually community-based vaccine clinics. They weren't on the mobile van, but they were community-based clinics.
So that's the total.
That's the total
number of vaccines that have been given out from the Health Department of Jefferson County.
This number comes from 2021.
From the year
And this was on our
2021.
annual report from 2020. And then mobile wellness. So you can see in 2019, we had a good patient base and saw 919 patients dropped off in 2020. We started to come back in 2021, and we are right on par with where we were in 2019. So we are kicking back in, and hopefully we'll be able to see as many, if not a little bit more, than we did in 2019. And then mobile healthcare logistics. So this is just for your information, things that we have to consider. Fuel costs, shoreline connections, maintaining the fleet, special driver's license for larger vehicles, driver training, and then some things, you know, we found out that it's helpful to make sure that we have the staff that are needed to move the vehicles, and also partner with where the vehicles are going. Some of the places we partner with have their own plugs we can plug in. So all of those are things that we've learned. We also added our community clinics to our marketing and communications, to our mobile app. And then we're also looking at right now, we've had several meetings this week. Where are we going with mobile clinics? We know that there's still a need. We know that there's still we still need to be able to meet patients in the community and provide those clinical services directly in the community. So we're trying to make sure that we're creating a mobile program that is sustainable into the future so that we can continue to meet those patients. And that's it.
About how old are the RVs?
So they're all different ages. So the kids did all in 2016. Our mobile health center, although it's not, we've only had it for 5 years. We bought it used.
I can't. I don't
And then
think
the
they-
senior dental
be
van is it 2014?
It's been that long, maybe, yeah,
What is it?
the senior rate,
2014 for the senior.
it's been that long.
2012.
I don't even think.
Yeah.
I'm just wondering
Yeah.
what the age
Yeah,
of them are.
Oh.
Do they seem to have high mileage on them already? They're doing okay.
I'm gonna let Steve answer that one.
The wellness van was bought used, so it had the higher mileage. And there are some things that we need to look at long-term on that one. The other two vans are relatively good operating shape.
And low mileage. They
Yeah.
probably have their little thing that they go to like, right around their county on 39 days to find.
Yeah,
Each of the mobile clinics has a schedule. We're all over the county. We try to, you know, go south, north, east, west. We try to be strategic in how we're located throughout the county. But we also partner with a lot of folks, so it depends on where we can partner and find a location to be available.
So what service do you actually provide? I guess, what's your highest service that you provide in the data? Most used service, maybe that's better. Sorry. And you may not have an answer, I get that.
I don't know if I have a single answer. Kids dental is highly used when we go into schools. That is a very high service that we provide in a lot of schools. For our mobile wellness, Mary is the primary care provider for some of our congregate living locations. And she sees a lot of patients at those locations. But she also does a lot of physicals for the schools too.
Yeah, sorry, it's a hard question to answer without the
Yeah.
data. Well, thank you.
Anything else? Thank you, guys.
Thank you.
Fantastic, thank you. Okay, and as a wonderful follow-up to that, the 4th annual Jefferson County Rotary Club benefit golf tournament is going to be coming up next month, September 16th at Oak Valley Golf Course and Resort. Just wanted to put a reminder out there we are still looking for teams, we're still looking for sponsors, but the Rotary clubs, all 5 Rotary clubs of Jefferson County have been tremendously supportive of our mobile wellness initiatives and are continuing to choose us as a designated person or designated charity for this year. So please remember, if you haven't and you would love, if you'd like to play golf or you know somebody who likes to play golf, we'll get you all the information, get signed up. The second thing I wanted to do was just give an update on our building project to let you know that we have been meeting. Steve has been doing a fantastic job of ensuring that we've had all staff included and all departments included in looking at the uses and the layouts and how the building will be getting put together. We are currently anticipating an estimated construction length of about 10 to 12 months once the bids are accepted and completed. Our completion date, sorry, is what I really was trying to get to, is we're looking at early 2024, February, March 2024. Of note to the board, or might be particular of interest, is our plans for our board space and community spaces. We are currently building out the room so that our boardroom will accommodate 16 to 20 chairs, but it will be designed in such a way as to have an opening to a large conference room that will accommodate over 80 individuals. So if we don't have a lot of folks, we're going to have the smaller setting. If we have individuals come for a larger setting, we have the ability to house up to in the 80s as far as individuals at this point in time with our current plans. So just a couple of updates of where things stand. Once things get solidified with the building committee, they'll be bringing those final recommendations back to the board. And that's all I have.
Any questions?
For the public that's watching this Homer, what did we pay for the ground for that new project and what do we have invested so far? So we paid, what was the amount? Land?
I can't
Off
remember
the top of my head, I will have to get back with you.
Dish.
Ish, we'll have to
$7
get back
million?
with you.
5 million?
Really?
3?
No, no.
Well, that's what I'm saying, just, you know, they have a lot of people. And they have a clue.
A lot of people have heard about this for about 2 years.
They might be digging in, that's not been listening.
We'll get those numbers. for you.
It's a little over 7 acres.
700,000, 7 acres. I got to see it the other day.
That's all utilities.
It's like this and it goes,
Yeah, that's all utilities.
plus the utilities.
Yeah, I mean,
It's
they're all.
Redeveloped.
developed property, it's ready.
It's, they're ready to go.
And you don't have to bring them.
Okay, our next item is old business. And we have none for the agenda. So,
I'll make a motion, we go into closed section. Second. Pursuant to 610.021. Subsection 1, confidential or privileged communication between the Board of Trustees and the County Health Department and representatives and attorneys acquiring or leasing real estate by Jefferson County Health Department. 2, the hiring, firing, or disciplining or promoting of particular employees of Jefferson County Health Department. 3, records which are protected from disclosure by law. That's number 14.
And then in particular, Mr. Chairman, I'm always the person to say exactly what are we doing, a personnel matter? Are we doing a real estate matter? Or is it something else in general? And
The Sunshine Law requires that we give the specific subsections of the statute and what is behind those subsections, and that's what we do every month.
I don't agree with that, but
We be 90 days.
yes, ma'am. So that's what we read outside.
yes, sir. Or it's good for the people to know what we're talking about while we turn the TV off.
So you have a motion, second, can I have a roll call, please?
Dennis Steele,
Yes.
James Prater.
Here.
Tim Pig. Amber Henry.
Yes.
Susie Davis.
Yes.